This is Crystal Fenn with MedPage Today here in Los Angeles at the International Stroke Conference, where researchers have reported results from the Get With the Guidelines Stroke Program registry. I spoke with Dr. Greg Fonero of UCLA, who presented the results here.
We examined the timeliness of tPA for acute ischemic strokes. This was a study in 25,000 patients, and we looked at the so-called door-to-needle time and whether it was within 60 minutes, which is recommended in the guidelines. And what we found is those patients treated within 60 minutes had better clinical outcomes. They were less likely to die in hospital and less likely to have a complication that can occur with tPA treatment, symptomatic intracranial hemorrhage. However, we also found why the outcomes were better in patients who had door-to-needle times within 60 minutes. There was only about a quarter of patients who were treated that met this time metric. So there's really a great opportunity for hospitals to improve the timeliness of tPA administration. One of the major factors we found that was associated with more timely tPA was the experience hospitals had. We also found there was great variation. Some hospitals, not a single one of their patients was treated within 60 minutes, whereas other hospitals, well over half their patients were able to be reliably treated in a timely fashion.
So with this kind of room for improvement, what do you think the implication is for hospitals? How can they start to improve these factors?
Well, this sets a strong rationale for a program that's been launched by the American Heart Association, American Stroke Association, known as Target Stroke, to share with hospitals best practices to improve their timeliness of tPA administration for acute ischemic stroke. And we hope by working together, setting goals, benchmarks, recognition, and sharing these best practices, we'll be able to help the nation's hospitals improve on this important metric, improve the quality of care and outcomes for their patients with acute ischemic stroke.
In this regard, stroke care may be able to take a lesson in the urgency of acute MI and trauma care.
So while it's been recognized that time matters in stroke, there really has not been previously published performance measures or a national initiative for improving the timeliness of reperfusion in acute ischemic stroke. Campaigns for acute myocardial infarction and for trauma have been very successful, and we hope to learn from previously successful programs in these other disease states and apply that to acute ischemic stroke. But now's really the time for target stroke.
So time is brain even after patients arrive at the hospital. At the International Stroke Conference, I'm Crystal Fenn, MedPage Today.